In the 20 years that we've now been running Mouth Cancer Action Month, the number of cases has increased from around 3,400 to now nearly approaching 9,000. And that's an incredible increase.
Most people are very tech and social media savvy these days, but I don't remember, other than you guys, I see your tweets and things that you're doing. I don't see a lot. I don't remember the last time I saw an ad on TV about mouth cancer.
What do you think can cause mouth cancer?
Not brushing your teeth.
What does HPV stand for?
It's the something virus. I should know it, but I can't remember.
Can you name 3 signs of mouth cancer?
Ulcers, gum disease, struggle with the third one.
It's a hidden cancer. It's not like a lot of cancers where there are obvious symptoms. People have coughs, they start coughing up blood, or they pass blood in their urine. It's a matter of that it's not normal for you, they get checked.
No, I think I was blissfully unaware of mouth cancer, throat cancer, until it happened to me. You see posters in the dentist that I was aware of it, but I didn't know much about it at all.
Campaigns such as Mouth Cancer Action Month are really important. The reason being is because we know that some mouth cancers can present quite late, and unfortunately we do lose lots of lives each year to mouth cancer. Roughly 8,000 people are diagnosed with mouth cancer each year, and if we can screen more patients and we can get to those patients earlier, then that might give us a chance to reduce the number of lives lost.
Mouth cancer is typically seen as a cancer of smokers and drinkers, and that obviously has a stigma attached to it, but that's absolutely not the case, and it's becoming progressively more apparent that lots of mouth cancers and head and neck cancers in general are actually caused by the HPV virus, and so there's a push to move away from this stigma of not being able to talk about it, and I think being open and honest about these things and allowing people to discuss the fact that they may either be worried or that they are suffering from a mouth cancer or a head and neck cancer is really important, and that things like social media is a really great outlet for that, and that the average age of diagnosis is actually becoming younger and younger as we progress, and so this is probably a really good forum for being able to discuss and disseminate results.
Mouth Cancer Action Month is a really important time of the year for ourselves. It raises awareness of mouth cancer amongst all our patients. I think particularly the young people, the younger generation, are not fully aware of mouth cancer. They come in wanting the nice cosmetic work, the whitening, the bonding, the veneers, and they're not fully aware that mouth cancer is looming. It's actually on the up and up.
It's all very well Googling something and, looking it up and reading what it says on the internet, but you've got to act on it, and you've got to go if you're worried. And they're not going to throw you out in the street if you go to them and say, look, I think there's something wrong with my throat, my tongue, I've got something funny in my neck. They're going to check it. And if you need treatment, the earlier you get the treatment, the better. So it's really important, if you're worried about something, to go and ask the professionals. Don't just sit there in the dark, terrified and scared and reading horrible stuff on the internet. Go and get checked.
Mouth Cancer Action Month, I really appreciate what you guys are doing. A lot more people need to get involved with that. So we always try to do something for this campaign in our setting, either with the blue badges or the blue lip selfies and raising funds, talking to patients, etc. But there's a lot more that can be done. There's possibly at a national level, we just need to engage the media, just tell people more about the disease. At the hospital level, everyone, doesn't matter what you can do, anything you can do will make a difference. So
we need to all work together in partnership. We can't do it without your help across the country to really get the message out there to the public about the signs and symptoms of mouth cancer, what they should be looking for, and the risk factors. If we can raise awareness on this disease, we can get early diagnosis and we can help save lives together.